Gastric bypass surgery can be considered like the grandfather of weight loss surgery. It was first done in the 60s and basically involves dividing the stomach to make it smaller, bypassing the flow of food from the stomach into the intestine. Basically think of it that when we eat food, the food first goes to the stomach. So from the stomach, it then travels through the intestine, which is about 6 to 8 meters long, in order to absorb all the nutrients. If we reduce the amount of food the stomach can hold and reduce the length of intestine that is exposed to the food, overall you will reduce the amount of nutrients and including fat, carbohydrate and all that's absorbed by the body. That's the principle of the gastric bypass, to make the stomach smaller and bypass part of the intestine. So you shorten the length of absorption as well. And that's kind of evolved into gastric band surgery, where the stomach is just made tighter with a band placed around the stomach, and another procedure called gastric sleeve surgery, where the stomach is stapled so that the volume the stomach can hold is smaller. So all these things are actually quite important, not so much because they prevent people from eating, but more important because it gives people that sense of fullness. A lot of people, once they get used to eating larger and larger meals, right, they're not satisfied with a smaller meal. So the body starts to crave for the same size of food portion. And this is the big problem. So it's not so easy to say, hey, just eat less, you'll be all right. And so that's why for some people, these kind of surgical procedures can help them to control that craving. And then that helps them eat less, so the weight comes down, they become more active, then they start moving into a new lifestyle. Ultimately, it's the new habits and the new lifestyle that maintains that whole new health status that the patient has achieved.